a situation where someone has a normal TSH, and the normal TSH range is 0.5 to 5. It varies depending on your age, but I'm just giving you a broad range. It is a very broad range. Someone with hypothyroidism who is younger than 65, I like to keep their TSH as an endocrinologist 0.5 to 1.5. So let's say I saw someone who had a TSH level of 1.1 at their PCP's office, and the doctor decreased their Synthroid dose. 6 weeks later, that level should definitely be changed, but a lot of times I have seen in my practice where the level is not changed for at least 3 months. And the TSH then is in the hypothyroid range, like about 9. During that 3-month time, you can gain a significant amount of weight, such as 20 pounds. And what's the most frustrating thing about hypothyroidism is that once you go back on the levothyroxine at that dose that brings your TSH level then back down to the 1.1, the weight doesn't magically go away. You have to work very hard to get that 20 pounds off. And since levothyroxine is dosed according to weight, now that the weight is 20 pounds higher, you probably need more levothyroxine to get your TSH down to that 1.1 range than you had been on prior to someone decreasing your dose. So what my medical opinion is, if a primary care provider wants to decrease your levothyroxine and your TSH is in the normal range, 0.5 to 1.5 if you're less than 65, if you're above 65, this is different. So I would say don't listen to this reel if you're above 65, because those ranges need to be a little bit higher. But if you're less than 65, doing well, feeling well, and the TSH is 0.5 to 1.5, speak up. Tell your PCP, no, I don't want to change the dose. I want to stay on this. If for some reason they refuse to do it, and I can't imagine that a PCP would, but I learned very early in medicine never to say never. If a PCP says no, then I would recommend changing to another PCP and also seeing an endocrinologist who would then write a note that says this is a good dose for this particular person.